Welcome to America Global. This is Dr. A.M. Khan again. Today's topic is informed decision paradox. To my colleagues in medicine who demand randomized controlled trials for lifestyle interventions while reaching for processed foods between clinic sessions. This message is for you and those people who have been stuck with medication for more than a year. So what is the double standard? So people who are stuck with the medication kindly share this video. So I'm asking these questions to the doctor. So what is the questions you ask? You ask patients, where's the evidence of holistic approaches, isn't it? Yet I ask you, doctor, where's the evidence that you follow the fundamentals you already know work? That is sleep, exercise, nutrition, stress management, and community connection. You need evidences for these things. The evidence for these isn't lacking. Your adherence is lacking, doctor. What you have convenient excuse? That when questioned why lifestyle medicine isn't your first prescription, you say patients won't listen. They just want a pill. They won't change. Come on. But let me ask you something very critical here, doctor. Have you actually told your patients that they can reverse their condition? Have you told them? Have you informed them? Is it possible? That is possible? Have you sat across your patient with type 2 diabetes and said clearly, this is reversible through lifestyle modification? Have you mentioned that to your patients? Have you told your hypertensive patients that diet and exercise might eliminate their need for medication? Have you informed your pre-diabetic patients that they stand at a crossroads where their choices in the next 6 months could determine the next 30 years of their life? Have you informed them? No. So what is the heart of the matter? Let's understand that. Did you assume, doctor, that they wouldn't be interested? Or did you presume they would prefer medication? Did you deny them informed decision making because you had already decided for them and on their behalf with your presumption assumptions? Informed consent isn't just about procedures and prescriptions, it's about possibilities. Every patient deserves to know what's wrong with them, what's the root cause, what the options exist, what outcomes are possible, what the evidence shows. When you write that prescription without discussing, right, left and center, just writing and become the agents of pharmacy, without discussing about any lifestyle or giving them the options or easier paths, you are removing what? Their choices. You're deciding on their behalf and you're making them invert. What is the uncomfortable truth here? That is, all patients deserve the opportunity to make that choice themselves. The moment you assume someone won't change, you guarantee they won't, because you never give them the chance, doctor. What is the challenge now? Let's understand the principles what we have forgotten as doctors. The challenge to the conventional doctors who have unknowingly become the agents of big pharma without their knowledge. Here's my challenge to those kind of doctors. For the next month, I want you to have the complete conversation with your patient. Tell every patient with a reversible metabolic condition that reversal is possible. Explain what it would take. Provide resources to them. Then let them decide. Track how many say yes. Track how many surprises you. Because I suspect the problem isn't with the patient's compliance. The problem is physician's assumption. That is, you're assuming that patient won't change the lifestyle. We become doctors to heal, not just to manage. You have to understand that. We learn that the most powerful medicine often requires no prescription pad. This is what we learned, isn't it? Perhaps it's time we trusted our patients with the truth and trusted ourselves to have the harder conversation. The conversation that takes 15 minutes instead of just 5 minutes just writing medication. The conversation that offers hope instead of lifelong management. The conversation that respects autonomy for convenience. Because informed decision isn't just a principle, it's the patient's right. Will you give them the right, or will you keep deciding for them? And if you're a patient, will you take the right, or you just give the whole right to the doctor, to your prescribing doctor? Please open your eyes, understand your root causes, ask the questions. What is the alternative? before they put you on medications. So don't just become sheep, just use some brain, use some wisdom. Because we are at our platform, we are reversing almost every metabolic condition at our platform. We are reversing them. We're bringing people off medications which they were hooked for almost 25 years. It's quite easy to reverse your condition. All you need is to change your lifestyle, change your habits, change your food, and we go there to guide you and help you how to taper off medications. We are helping day in, day out. Like every day, we help people to come off medication, diabetes or hypertension or lipids or any other metabolic conditions. So don't get stuck with the chronic management of your disease by your doctor. Give yourself an opportunity to look for an alternative and holistic ways so that you achieve a healthy and a better life, a life free from medications. Thank you for watching eMedicard, and I appreciate if you share this video to your treating doctor to start with and to your family and friends so that they all get informed that you have the right more than your treating doctor. So kindly exercise that right. Thank you for watching eMedicard Global. Take care. Shapake.